Hi, I'm Dr. Fauley at Care Animal Clinic, and I was just going to kind of go over a few things about dental care as far as our pets go. It's important for dogs as well as cats to do the right things, to pay attention to what's going on in their with their teeth, their mouth. Hygienically, it helps them be around people more, plus it's just a healthy thing for him. This is Harley, my dog. He's 6 years old, and he actually had his first dental cleaning a year ago. So this is how it looks when they're in good shape. You know, there's hardly any tartar along it. The gums are nice and pink, and they're not inflamed at all. Come on, Harley. That looks good on that. And then over here, same thing. It should kind of, there's a little bit of tartar that's accumulated now after a year, but it's slowly, you know, it's a slow progression. And so that's why sometimes it can get away from people. They don't even notice it, or they notice that there's a breath problem. So we like to have them cleaned regularly. What happens with the dental cleaning is we don't anesthetize here at Care Animal Clinic. We do sedate, though. What we're doing is not painful, so they don't have to be anesthetized like they do for surgeries or something. But what happens is we just give them a little bit of sedation so that they don't mind the scaling and the polishing. That's what happens when people go in to get their teeth cleaned. Their teeth are scaled with that ultrasonic scaler that vibrates and sprays water out, and that's actually what gets rid of the tartar. The tartar is a hard calculus. It's called calculi that forms a layer that forms on the teeth, and when it is thick enough, it starts rubbing against the gums. When it rubs against the gums enough, the gums get inflamed. That's called gingivitis. When they are inflamed so much that they actually start receding, and you have a receding gum line, that's the start of periodontal disease. So you want to try to avoid all that by just having this tartar removed regularly, polish the teeth, and so forth. So what I was saying was that we sedate them, then we go in and scale their teeth. That doesn't hurt. Then we go in and polish the teeth. That doesn't hurt. That's the polishing is with that cup that spins around that has that Profi paste, the strawberry or bubblegum flavored. It's kind of gritty. And so then we polish it, and then we put a layer of fluoride on it afterwards. And if you do that, some dogs need it every year, some dogs need it every few years. Harley didn't need it till he was about 5 years old, was the first time we needed it. He's not going to need one probably again for about another year, so it'll probably be every 2 years for him. But what we do is we go ahead and sedate him. We give a little bit of an injection in the vein that makes him just kind of get sleepy. Then we go ahead and use this. This is a dental cleaning, a very typical unit for cleaning the teeth. The first part here, this is the scaler. And it's got a little tip on the end that sprays water out and vibrates. These are all the controls, and it just goes ahead and scales all the tartar off. That's fine. Once you get once you get the tartar off, then the teeth look white and everything, but you still need to polish them. And that's what this instrument here is for. This is just a scaler. It's got one of those, it's called a Profi cup on the end of it, and you use the paste, and then that polishes the surface of the teeth and makes it very smooth, cleans it off, gets it cleaned under the gum line, and then we put a layer of fluoride on it. This is just a foam. It's like a mousse, but it goes on the teeth, and it leaves a layer of fluoride behind to keep it healthy. Things that we will do and check on when you have bad teeth are extractions. That's the only other thing we do. There are specialist dentists that will do fillings and not really fillings, I guess it'll probably be more like root canals, and then they'll put caps on them and crowns and all that kind of stuff. I don't do that here, but what we do is if there's a bad tooth, we'll do an extraction. But before we do that, we will use this. Sit, Harley. Sit. This unit here is a dental X-ray unit, and it kind of comes out like this. So when they're sedated, you can take this all the way out, and you focus it down on the tooth, whichever one that is questionable, and we just take an X-ray of it, and then we're able to determine by looking at the roots and the health of the tooth if that one needs to be removed or not. So it's a very helpful thing to be able to see when you can't see below the gum line. All you can see is the tooth itself. It's a very helpful thing to be able to see what's going on with the roots, and that's what this helps us do by evaluating parts of the teeth that we can't see. So anyways, it's a good idea to stay on top of it. If you can brush your dog's teeth, give them healthy food, give them things that they're allowed, that allows them to chew on, that's that toughens up their gums and just keeps their mouth in a healthy state.